All right, Dr. Alicia Arbaje is here. We're going to talk about health care and those up there in age. Megan loves when I role play. So let's pretend I'm 180 and I'm coming into your office,
okay.
All right? I'll never be able to see you again because of this health care plan.
Yeah, so there's a lot of myths and concerns about this new health care plan. There's a lot of debate and controversy, but really there's a few important points that I think are important for older people, a few good things that could potentially come out of this health care bill.
I won't have to switch doctors.
You don't have to switch doctors. And one of the important things is that actually your doctors may actually start to talk to each other more easily. And one of the problems that older adults face is that they have many doctors, many healthcare providers, and they can't keep everything straight and keep all the information with everybody. So one of the provisions in the bill is to try to incentivize care coordination, to try to incentivize doctors to communicate with each other so that seniors don't have to struggle so much in that aspect.
What prevented that before?
Yeah, that's a long topic, but the 15-minute visit, the way our payments are structured for doctors really doesn't allow for that kind of communication.
How about my prescriptions?
So there's increased affordability for low-income seniors caught in that donut hole in Medicare, that coverage gap where they have to pay 100% of their premiums of their prescriptions for a while. So the new health care legislation is reducing that donut hole temporarily and also providing assistance for low-income seniors in that area.
Medicaid, Medicare.
That's right. And one of the important things, actually, we were talking about before, is that there's not a lot of people that are trained to take care of older people. We have programs to help cover their care, but we don't have people to help provide that care. So one of the aspects of the legislation is to increase grants to provide training for nurses, for doctors, for psychologists, pharmacists, the whole team of people that are needed to help care for older people, including people in nursing homes.
All right, let's wrap it up with Miriam, who was just here. Would you advise people who are maybe starting a college career right now to look into this?
Geriatrics, gerontology, huge profession, and there's going to be more and more scholarships, more training opportunities for people interested in this area. Absolutely. We know that the number of older people is increasing day by day, so a very important field.
All right. I know a lot of your patients come in. Do they ask about the health care bill? Are they worried about it?
Yeah, I think they are because it's very confusing, and especially with the Part D legislation that was passed not that long ago, there's been a lot of changes. But I think, with some reassurance, we have to wait and see kind of how all of this plays out. But I think there are some beneficial provisions that could hopefully come out of this. And one of them is to actually help keep seniors out of the hospital, which all seniors really prefer. So there's programs in place for that as well.
So just break it down to them and explain. They're going to love the part that my doctor's going to be talking to your doctor.
Talking to the other doctors.
Oh, my goodness.
Yeah, that's the ideal.
All right. Thank you, doctor.
Thanks.
Very good.
Nice
all
to be
right,
here.
There you go. Now we're all calmed down. All right. I feel like I feel my age again.
Like you're 100 now.
Yeah, right. Cherie?